My name's Paul Bingelli. I'm 49 years old. I was diagnosed with muscular dystrophy about 10 years ago. Two forms of rare muscular dystrophy. My weakness level is been increasing dramatically over the past couple of years, and even worse so recently. I'm at the point where I can't walk at all without assistance. And even then, I still take falls if I'm not careful. My hands are weak. It's one of my main forms is distal myopathy, which affects my extremities first. My hands, my feet, my ankles. I have no muscle in my ankles, so my feet just flop down. So trying to walk is not hardly possible. I have to swing my legs just to get one foot in front of the other. It's frustrating, it's difficult, and it's just going to get worse. I remember when I was younger, all my life growing up, I'd play Little League, basketball, football in the backyard with kids. I was always good at everything I did. Noticed I was starting to not be as strong as I once was after I got out of the military. A few years later, I just seemed to start getting clumsy. And one day, just walking into the store, my toe caught on a small crack in the pavement, and I ended up going face first into the side of somebody's car. My regular doctor luckily knew Dr. Griggs personally, who's a neurologist. He's the head of, was the head of the Neuro Center as well as Neurology Magazine for a long time, and he diagnosed me with two forms of muscular dystrophy. And now that I've gotten to the point where I've started having pain from my neck down to my feet, I ended up here with Dr. Hanna, and Dr. Hanna helped me with what he could, but thought that the ketamine therapy would possibly benefit my condition, and with a possible increase in my strength, which will never happen on its own. So that's why I'm here, to see Dr. Hanna and see if this out-of-the-box idea he has is going to succeed and help me regain, even if it's 10-20% of my strength, which would be absolutely huge, would be amazing. And I could never thank him enough for that. So at least it's an option for me right now, and that's why we're here. My mobility limitations are quite severe these days. I can't walk without being able to hold onto a wall or assistance or leaning on someone. In order to move one foot in front of the other, I have to swing my legs out because I can't raise my toes. There's no muscle left in my ankles. My hands and arms, I can make a fist, but it's probably the fist of a 5-year-old. I can still move around. I can't bend my index finger. The muscles are already shortening in the backs of my fingers, so it's tremendous pain just to bend them. But hasn't affected the rest of my hand yet. I use a trapeze at night in my bed, and in order to turn from side to side, I can't grab the trapeze with my hand. I have to hook my wrist over it, and that's how I can lift my body up enough to turn from one side to the other side. And that's the extent of my strength, is lifting my body, because I don't have the strength in my hips to slide my body over in bed. I literally have to lift myself up onto my elbow just to get my hips moved over. Lift my leg up, I can move them side to side, but that's the extent of me lifting my toes at all. If there was any pressure on it at all, even the slightest amount, they wouldn't go up. It includes my legs as well. If you put a pound weight on my knee, my legs aren't going anywhere, and I can't even lift my feet off the floor from a sitting position. Okay, I'm in about 3.5 feet of water. The water is up to my waistline. I'm going to try to do some squats. One, 10 laps. My right leg's giving out. I'm having a very hard time getting it to move forward.
Hey, hi Paul.
Hello, Dr. Hanna.
How are you?
I'm doing fantastic.
Wow.
I'm able to walk without having to watch where I'm going or grab the walls.
Wow. And were you able to walk like that before?
Not in over a year. I'd always have to hold on to something.
Wow.
And always hunched over a walker or grabbing a wall, being worried about my safety. I'm still not 100% connected right now.
Yes. Okay, and this is only 4 days after ketamine.
4 ketamine treatments so far, that's it.
Okay.
Aim for the
Hallelujah.
5th one and see what happens on this weekend.
Okay, let's hope for the best.
Absolutely, thank you.
Good. Thank you.